Hello everyone. Today's class you'll be learning about classification of antimicrobials, which are very common drugs used in case of any type of fever. So to begin with, what is chemotherapy? Okay, this comes in chemotherapy. So chemotherapy is mainly dealing with use of chemicals or for infectious diseases. Okay, it is use of chemicals for treatment of infectious diseases, either to destroy the microorganism which is causing it without harming our host immune system. Okay, host tissue and immune system it will not harm, only those which is producing the infectious disease are killed. We derive this chemotherapy is mainly given through antibiotics and also with some other group of drugs, but mainly antibiotics. And these antibiotics are substances which are mainly produced by microorganisms, and they have efficacy to destroy or they prevent growth of other microorganisms. So that is what we mean by antibiotics mainly. So main theme of today's class is to learn about classification. So classification is also based on one classification is based on their mechanism, which is commonly used and very important, and based on their spectrum also we have classification. So based on whether they kill or prevent growth. Okay, like that also we have classification, we'll see that later. So to begin with, how it is classified based on their mechanism is, it is like this, based on the cell wall synthesis inhibition. Like next there is a picture, okay, based on whether there is cell wall synthesis. Cell wall synthesis inhibitors are penicillins, cephalosporins, vancomycin group of drugs, and bacteristracin and cyclosporin. Individually, when you study, you will understand in detail which step of cell wall is inhibited. And some things which will damage the cell membrane by causing some leakage in the cell is polymyxin, colistatin, amphotericin B and nystatin. Very important. And drugs which will bind to ribosome and which will inhibit protein synthesis, wide variety of group of drugs like chloramphenicol, tetracycline, erythromycin, aminoglycosides, clindamycin, linezolid, streptogranins. So these all will cause protein synthesis inhibition. So this is a unique mechanism, that is they inhibit DNA gyrase. Only drug is fluoroquinolone group of drugs. Very important. Fluoroquinolines, they are bactericidal and they act by inhibiting DNA gyrase. And those drugs which will inhibit DNA function are that is DNA dependent RNA polymerase is inhibited by rifampicin, which is an anti-TB drug. And anti-metabolite, they inhibit various steps like sulfonamides, sulfones, trimethoprim and pyrimethamine. So this is mainly how it is classified. So as I already said about the classification, so in this picture you can understand little in detail. So first class what we saw was cell wall synthesis inhibitors like beta-lactams, vancomycin, cycloserine and bacteristratin. Beta-lactams will bind to penicillin binding protein and it will affect the like cross bridging of the cell wall synthesis process, which is the last final step of cell wall synthesis. Likewise, vancomycin will inhibit the final step of cell wall synthesis. So thereby they form or damage the cell wall so that the water will enter into the cell and the cell will burst, leading to death of the cell. So next class is those which will damage the cell membrane. So they mainly act by forming pores in the cell wall. For example, amphotericin, which is an antifungal drug, so they act by binding to ergosterol, which is one of the component of the cell wall of the fungal cell. Okay, so they will bind to it and they form pore. Okay, once there is a pore which is formed, so the contents which are present in the cell will enter out, or the water which is present out will enter in, and that will also result in cell burst and cell death. DNA, next group is DNA gyrase inhibitor. So DNA gyrase and as DNA dependent RNA polymerase which is inhibited by rifampicin. So all these will help hamper the replication process of DNA. Okay, DNA gyrase is involved in removal of supercoiling which is occurring backwards. Once there is reading of codon and the replication process will move on, so there will be supercoiling which is inhibited mainly by gyrase. They will cut or they will nick and open the supercoiling, whereas this DNA dependent RNA polymerase is important in forming in elongation of cell chain. So both of these class of antibiotics, they will inhibit the formation of DNA. If DNA is only not formed, so all the cell functions is hampered. So thereby they will result in cell death. So last class which we saw was those drugs which will inhibit the metabolic pathway by and they are called as antimetabolites. So for example, sulfonamides, trimethoprim, all will act by inhibiting the folic acid synthesis. Formation of folic acid from PABA, that is para-aminobenzoic acid, is prevented by these class of antibiotics, and this folic acid is one of the important thing in synthesis of DNA, one of the important material it is. So last class is about inhibition of protein synthesis. Protein is synthesized by the replication process. There will be one, like each codon on the DNA is red, and this happens mainly in the ribosomes, right? So the 50S and 30S ribosomes will bind, and they will the replication process will go on. So these group of antibiotics either will bind to 50S and 30S, or some also bind to aminoacylate tRNA synthase, which will help in binding the new tRNA which is binding to the next codon. Those steps, various steps, are inhibited by these classes of antibiotics, that is tetracycline, chloramphenicol, aminoglycoside, and erythromycin, clindamycin, all these class of drugs. So thus they inhibit the protein synthesis. So that is about the mechanism of classification based on mechanism of action. So based on whether it will just prevent the growth of organism or they will kill, they are classified as bacteriostatic drugs and bactericidal. Static, as the name suggests, it will suppress the growth. Okay, bacterial multiplication is prevented by this bacteriostatic group of drugs, and example is sulfonamides, tetracyclines, linezolid. Mainly those which inhibit protein synthesis are termed to be bacteriostatic. Chloramphenicol, clindamycin, all these will inhibit the bacterial growth. Bactericidal, those which will kill the bacteria, are mainly cell wall synthesis inhibitors and those which will act on DNA. Penicillin, beta-lactam group of antibiotics, as we also earlier. Aminoglycosides, fluoroquinolones, DNA-dependent RNA gyrase inhibitors, and rifampicin. All anti-TB drugs are bactericidal. Metronidazole, vancomycin, all these are bactericidal group of drugs. Moving on to the other type, where the antimicrobials are classified based on their spectrum, antibacterial spectrum, as narrow spectrum and broad spectrum. Okay, narrow spectrum means either these group of drugs are active against either gram positive or gram negative. For example, penicillin G, which has a narrow spectrum of acting only against gram positive organisms. Likewise, aminoglycosides are mainly important for gram negative organisms. Broad spectrum example, classic example is tetracycline and chloramphenicol. Broad spectrum means they will suppress both gram positive, gram negative, and also they inhibit the growth of many other organisms like rickettsia, chlamydia, mycoplasma, and some protozoal. Okay, this is what is mean by broad spectrum antibiotics. So some antibiotics are also given for prophylaxis. So you should know what is a prophylaxis. So prophylaxis means use of antibiotics to prevent infection. For example, you will be going to an endemic area where there will be malaria, right? So you know if you go there, there will be a sign of infection. So you will take some prophylaxis to prevent your infection. So that is taking of antibiotics to prevent infection. So in dentistry mainly, the prophylactic use of antibiotics is not that used routinely except in patients who are immunocompromised, who are prone for infection. Okay, so in cases of deep scaling, tooth extraction, periodontal procedures like oral or maxillary surgeries we use where there is a chance of transient bacteremia and which will lead to infection. So those conditions we use antibiotics. Also in special risk patient who have depressed immunity, as I already mentioned, or insertion of prosthetics, so there will be a chance of infection, implants, and also prolonged surgeries. Antibiotic prophylaxis is very important. Few terminologies I have mentioned. Superinfection means when you'll be using a antibiotic for one infection, but you will end up with a new infection in the span of using of antibiotic. So this is mainly seen when the antibiotics are used extensively for long duration of time. Okay, inappropriate use, all these will end up with such sort of new infection. And why does this happen is and this mainly happens with those drugs which are having broad spectrum of activity, and this happens because there will be alteration of your normal bacterial flora which is present in intestine, respiratory system, and also genitourinary system. Very important, these three areas. So what happens here is normally in our body the this normal flora will produce some host defense mechanism by inhibiting the bacterial growth colonies and also pathological organisms by producing some antibacterial substances called bacteriocins, and that is how it will help, and they also compete for nutrition. So because of these two reasons, so there will be super infection by new infection. If this is destroyed, then there can be dangerous infection which is produced due to the normal common cells which are present in the body. So that is, as I already mentioned, these are mainly seen with broad spectrum of antibiotics, and few examples are here. Clotrimazole can lead to oral candidiasis, and the patient will present with oral thrush, diarrhea, vaginitis. Similarly with cloxacillin, which is given for staphylococcus, so enteritis can happen. Metronidazole, vancomycin, Clostridium difficile infection, very important. Clostridium difficile infection, which is occurring mainly with uh, Pseudomonas colitis. So the treatment here is metronidazole or vancomycin. For infection with staphylococci, which is manifested as enteritis, so we can use cloxacillin. Okay, and E. coli can happen. So it can present as UTI, and we can treat with norfloxacin. So also Pseudomonas also can happen in case of severe antibiotic use. So it can also present as UTI, and Pseudomonas resistant penicillin, that is carbapenicillin or ticarcillin. Okay, those group of drugs can be used. So oral candidiasis can happen most commonly with various antibiotics. So it will mainly present with oral thrush, diarrhea, and vaginitis. So clotrimazole can be given. One more important terminology is use of probiotics. Probiotics are substances which contain viable non-pathogenic microorganisms. Okay, and these are mainly given to improve the normal intestinal. They are given administered or and they help in improving the your intestinal micro flora. Like if there is any super infection, so in those conditions also this probiotics can be used. So most commonly used probiotics are lactobacillus, okay, bifidobacterium, streptococcus salivarius, and some enterococci, and saccharomyces boulardii. So these are also commonly used for anti as a probiotic agent, and they are most commonly useful in acute infectious diarrhea, okay, and antibiotic induced diarrhea. So some and probiotics are also being used and been shown to be effective in ulcerative colitis and IBW syndrome. Sorry, IBS, in irritable bowel syndrome also. They are more prone to be very useful. This is for it for today's class. I have mentioned two MCQs. Please go through. Thank you.